Dr. Soto. How are you?
I'm great, Amy. How are you?
Good, thank you. I had some questions about the decision-making process when it comes to plastic surgery.
Okay.
Because it is such a big life-changing experience.
Absolutely. It's an important decision.
Okay, first, prior to plastic surgery, what sort of research should a patient do?
Well, I think that first of all, it's a general truism that the better educated you are going into your consultations, the easier it is going to be for you to communicate with the surgeon you choose, and the happier they're going to be able to make you. Excuse me. The best thing to do is to do lots of homework on the surgeon you're going to see. You really want to know where they went to school, where they did their training, how long they've been in practice, what their areas of expertise are. All of those things are very, very important. The fact is that not all medical schools are created equal, not all residency training programs are created equal, and so therefore not all physicians are created equal. We're human beings too, and there are going to be things that I'm good at that other people might not be quite as good at, and conversely there are things that I'm not quite as good at as some of my colleagues. And so you want to do your homework and make sure that the surgeon you're seeing is the right person for you. Going into your consultation, it's probably a good idea to also have read a little bit about the procedure and the area of your body that you're concerned about, because that will allow you to ask the most intelligent questions when you're visiting with your surgeon for the consultation. You don't want to get out of your consultation and feel like, oh shoot, I forgot to ask a really important question. So understanding a little bit about the options before you get there is also a good idea.
Okay. And what websites do you recommend patients to check out to get factual and honest information about their surgeon?
Well, the first place to go would be the surgeon's website, because most of us will include a lot of good information about where we went to school and where we did our training and what certifications we've earned. And those certifications are really important. And by the way, it's really important to understand that it's not enough for somebody to tell you that they're board certified. It's not even enough for them to tell you that they're board certified in plastic surgery, because that isn't really the whole truth. What you really want to know is what board certified them. And if they can't say, or if it doesn't say on their website that they were board certified by the American Board of Plastic Surgery, then they're probably hiding something from you and you should go somewhere else. The American Board of Plastic Surgery is the only board that requires the training, experience, and judgment that most of us are supposed to have before we start practicing plastic surgery. So the first place to go is the surgeon's website. But of course, most of us use those websites as marketing tools, and you should take some of that with a grain of salt. And go to objective sites like the site for the American Society of Plastic Surgeons, which I believe is plasticsurgery.org. The site for the American Society for Aesthetic Plastic Surgery, this organization here, and their website is surgery.org, and the American Board of Plastic Surgery website, which I believe is abpls.org. And that website is actually very useful, because there's actually a link on their main site where you can click on and find out if your surgeon is board certified. I think the link says, "Is your surgeon certified?" And so that's a good place to look.
Okay, great. And what do you think are the very most important questions patients should ask before going through with their surgery?
Well, I think there are several areas that need to be explored. I think it's very important to understand, first of all, that you're not just choosing a surgeon. You need to be asking questions about multiple things. You need to, first of all, understand you're choosing a surgeon. You need to make a choice about the anesthesia provider. You need to make a choice about the facility. All of those things are going to affect your safety and the likelihood of you being happy. You also need to think a lot about the procedure that is being recommended to you and the options. And please understand that not all of the options that are offered to you in one office are going to be offered to you in other offices, because to some extent, the options that you're offered are going to depend on what that particular surgeon knows how to do. And some of us know techniques that others don't, and some of us have experience that others don't. And so don't expect your options to be the same in one office as they are in another. And so you need to be very careful in how you make these decisions as far as your safety and your happiness goes. For safety's sake, my opinion is that you should only use a board-certified plastic surgeon, somebody certified by the American Board of Plastic Surgery. I think you should only agree to have surgery done when there's going to be a board-certified anesthesiologist involved. And I think that you should only agree to have surgery done in a facility that has been accredited by a national accreditation body, like the American Association for the Accreditation of Ambulatory Surgical Facilities. That's the association that accredited my facility, and I can be confident telling my patients that we're a very safe place to have surgery because of that very rigid accreditation process. Considering the operation itself, I think it's really important to be sure that the operation you're agreeing to is one that is very likely to make you happy. Not the one that's really affordable for you, not the one that's going to have the short little scar you want, not the one that's going to be really easy for you to schedule around your work schedule. All of those things are very important, but none of those things are as important as you being happy when we're done. In other words, 6 months from now, if you had an operation that was very affordable for you and you got the cute little scar you wanted, but you'd look bad, you're not going to be happy. So it's really important to make sure that the operation you're agreeing to is one that really is likely to make you happy. And then all that other stuff can be worked out.
All right. Well, thank you so much, Dr. Soto, for your time.
It's my pleasure.
And we'll see you next time.
Okay, thanks.